Welcome back to our broadcast live program today on World Cancer Day. My name is Nicholl and I'm the Head of Communications and Marketing for the Union of International Cancer Control, UICC. Our next guest today is Ciarán Nicholl, who is the Head of the Health and Society Unit at the Joint Research Centre of the European Commission, and we will be talking about the importance of data and research today. Welcome, Ciarán.
Thank you very much, Nicholl, and thank you also to the Union for International Cancer Control for the invitation. Great to be here.
Ciarán, the European Commission has made the fight against cancer a priority. What is the role of the Joint Research Centre in this fight?
Well, first of all, the European Commission's Joint Research Centre specialises in independent evidence for EU policies. And our role in cancer, well, that stems back to, it all began in 2013, when we started building what we call the pillars of the Knowledge Centre on Cancer. So the first pillar we could say is we have developed and we take care of the European Cancer Information System. This is a system in Europe containing over 30 million cancer cases, covering 34 cancer sites. And it is used for monitoring and projecting the burden of cancer in Europe. Now, that system is going to grow and expand in the coming months and years to include linkages to cancer determinants, really providing evidence. We're going to include staging data, treatment data, making it more timely, etc. So that's pillar number one, the data. Pillar number two, we also developed the European guidelines for screening and diagnosis, and provide European guidelines on a quality assurance scheme covering the whole cancer healthcare pathway. That means from prevention to screening, diagnosis, treatment, post-treatment, psychosocial care, pain management, palliative care, the whole way through. So these guidelines ensure that minimum essential standards are fulfilled, because unfortunately, even today, the patients are falling between the stools of the healthcare pathway. A third pillar is, of course, focused on prevention. We know that estimates tell us that about 40% of cancers are preventable, and we need to do more in that area, and we have a knowledge gateway. This is a reference point for policymakers in what to do to improve, or let's say to reduce your risk of getting cancer, basically on nutrition and lifestyle. And then we also have a facility, an information system called the EU Platform, for rare diseases to treat rare cancers, including childhood cancers, which has recently been published on the European Cancer Information System. So basically, these are all together. And then finally, the new kid on the block, when it comes to tackling cancer, was launched on the 2nd of February by our President, Ursula von der Leyen. And that is the new European Cancer Inequalities Registry. So all of these fit together under a knowledge centre on cancer, whose mission it is to provide scientific and technical alignment of all Commission and European activities on cancer, bringing everything together, because we know what to do, we know how to do it, and this will leverage the impact. Back to you, Nicholl.
That is a very important work. I know that you have over 40 staff members that help you with that, and we'll get back to how this data can be used for the fight against cancer. Our campaign today, the campaign that we launched globally on World Cancer Day, is about highlighting disparities and barriers that people hit at every turn when they seek cancer care. And it's very important to understand that these barriers and disparities not only occur in low and middle income countries, but also in high income countries and in the heart of Europe. So can you highlight some of these cancer care gaps and barriers that you've observed in Europe?
Well, to be honest, Nicholl, it's difficult to know where to begin. The situation is that bad. North to south, east to west, from prevention to diagnosis to treatment and post-treatment, all the way to palliative care, there are disparities everywhere. And this is where I think it'll be very important to communicate them. If we want to close gaps, inequality gaps, the first thing we need to do is identify them, display them, and communicate them. That is a first step. Now, to give two little examples, now take breast cancer, the most common cancer among women, and screening for the evidence-based recommended age group is known to increase, let's say, the results and positive outcomes for those patients, unfortunate enough to go through that pathway. But then if you look at the various member states in the European Union, and you see what percentage of women are attending these screening programs. In one member state, you will see 89%, but in another member state, you will see 8%. So that's an unacceptable disparity that I think has to be addressed. If you take the national cancer plans and the importance of psychosocial care, all of our national cancer plans express the importance and the need for psychosocial care. However, if it comes to having the correct indicators, recommendations, criteria in place to implement it, only one national cancer plan can do so properly. So again, we know what to do and we know how to do it. And this is going to be the key to addressing those disparities. So yeah, we hope that the disparities aspect and the inequalities will be a leverage, a power to finally make the change that we need. Back to you, Nick.
And as you rightly said, before we can tackle these disparities, we need to recognize them. And what you just said is so striking, because we know that all these gaps and barriers and disparities, they cost lives. They cost lives every day. So it is so important to address them. You mentioned the new Europe Beats Cancer Plan that was launched last year, that was amended this year. And you also mentioned the Cancer Inequality Registry as one of these points of the Europe Beats Cancer Plan. To come back to that, can you explain to us why data is so important and what the Cancer Inequality Registry can contribute to the fight against cancer?
Well, the European Cancer Inequalities Registry is a very interesting one, because the European Union is built on very strong values. So when it comes to equity, fairness, equality, everyone should be treated the same. Everyone, no exception. So, and then secondly, when we often do this, when we sit around the table with the member states, okay, lately it has been more virtual than physical. What's amazing is the member states of the European Union, and all over the world for that matter, want to help each other. They all want to help each other. So where there's a will, there's a way. Now, equalities, like I mentioned before, if we display them and communicate them, we get them out there. Then we're kind of going, oh, this is not acceptable. Take, for example, lung cancer incidence. If you look at the percentage of people or number of people getting lung cancer is called incidence in the European Union. In one member state, the incidence is double the EU average, very unfortunate. And in another member state, it is half. Good, there's a good practice. So we have all these excellent practices that we have, and we know that we now need to implement and to leverage that. So basically, in a way, the European Cancer Inequalities Registry will be a political arm to bring the pieces of the cancer jigsaw together. It will act as a kind of a social fabric, exposing our passion and our more heartfelt ideas to do something about this, to start taking action on the ground where it matters. Thank you.
Do you have the commitment of all member states to contribute to that?
Good question. The European Union and the Commission does not have a legal mandate to impose cancer prevention, control and care strategies within its member states. That has been decided, and with total respect to that. So in a way, it makes it a bit more challenging. However, good news is that for the first time in the Union and in the Commission, we have the pillars of the Knowledge Centre on Cancer in place that I mentioned before. European Cancer Information System, European guidelines, quality assurance schemes for cancer care, prevention all the way to end-of-life care. And we have the Knowledge Gateway on prevention. So all these places, or all these entities are in places. We have the systems, the platforms, the portals, and the gateways. We also have the Europe's Beating Cancer Plan. On one hand, 4 billion euros, which is going to do excellent work. On the other hand, we have the Mission on Cancer. So these three entities together make a formidable force where nothing should be multiplied by 27 member states. We can do this together. The differences and the inequalities and all the aspects, they can be addressed in a central way most or almost all of the time, because mostly we're talking about essential standards, bringing up the level of prevention, care, etc. So it is challenging, but I think now we are positioned in a very good place to make this happen. And I think we need to make it happen. Thank you.
It's a very ambitious plan. It's great to see that all these objectives have been included. By when will people in the European Union see a difference?
Well, for example, now we are basically doing a feasibility study for the new European guidelines on quality assurance scheme for breast cancer. These evidence-based guidelines are state of the art. You will see many continents and countries throughout the world already beginning to use them in some shape or form or the other, like China to the Americas, etc., etc. So these feasibility and pilot studies will demonstrate that, and we are very confident that it will improve the cancer care. So basically, I think it has begun, but we need to be faster. I think we need to coordinate more together. Absolutely no room for duplication. And that's why, in a way, we have the Knowledge Centre to align and coordinate. And we're working very closely with our colleagues in the political directorates general, DG Santé and RTD to do that. That's the DG Research. By the way, with the Knowledge Centre on Cancer, we've made links to so many other aspects. In the future, we'll soon be geographically positioning, in fact, with the next call for data, the cancer data. That means we can start linking it to other geo-positioned data sources, like take lung cancer and exposure to radon or exposure to particulate matter 2.5 microns. Take socioeconomic indicators, take behavioral indicators, etc., etc., exposure to carcinogens. So it is beginning. The knowledge is going to be generated. The dots are going to be joined. And this is going to be coming very quickly now, and with the new priority that is on cancer, and that will start leveraging impact. And at the end of the day, it's all about leveraging impact on the ground, in the setting, for the cancer patient, for the citizen, etc. So that will be coming soon. Challenging as it may be, it is time to work together on this. And I think everybody will want to put their shoulder behind the wheel to drive this forward. Thank you.
The dots will be connected is a very powerful message, because by sharing knowledge, we will become stronger in the fight against cancer in the cancer community, together with organizations, governments, individuals. So I wish you all the best for that very important work. I would like to thank you once again for joining us today, and all the best. Goodbye.
Thank you very much, Nicole. Thank you, everybody, and to everybody out there. Take care. Take care of your health and well-being. We have the guidelines, we have the recommendations, so let's do this all together. Thank you very much, and all the best.